Hello viewers, this is Dr. Shaileshkumar Garge. In our Ask Doctor series, one of the patient has asked for the varicocele doubt. Sir, after varicocele grade 3 treatment, any chance to form it again? So, if this question is general, what kind of first thing we need to know what kind of treatment, or whether it's medications or a definitive treatment like a surgery or microsurgery or a non-surgical embolization, varicocele embolization. So, because with a different treatment, the chances of reformation or recurrence will vary. Like in the open surgery for the varicocele, the chances of reformation are 20 to 30%. With the microsurgery, it is like 5 to 10%. With embolization, it is like 5 to 10%. So the chances of recurrence is different in different form of treatment. Yes, with most of the treatments with so whether it's surgery or embolization, there is chance of recurrence in the varicocele, because we need to identify the cause of the varicocele. Like some patients have constipation or chronic cough, or there is idiopathic, means we don't find any cause. Their walls in the veins of the scrotal veins are already weak, that's why they form. So if their veins are weak, sometimes even of the treatment, these veins, the new veins, whatever the walls they form, they can also become weak over a period of time. So there is chance, and these veins have a tendency of reformation, and that's why if you don't remove the cause of the varicocele, there is reformation chance is definitely there. So in general, varicocele can recur. Yes, it can recur. So you have to take the precautions even after the surgery or medications or embolization. You need to be in the regular follow-up just to check if you are developing any symptoms or any swelling or recurrence in the future. So I hope this solved your doubt. If you have any more doubt or another doubt regarding the varicocele, please put them in the comment box. I'll be happy to read them and answer them in our next video. Thank you.